Hi everyone, I'm here with Rumbi, and she is currently a GP trainee. And today we're going to be talking about the work that she does and the projects that she's involved in. So, would you like to introduce yourself, please, Rumbi?
Yes, firstly, thank you so much for having me here. Honestly, I'm so privileged. We were having a little catch up earlier, and I was talking about how it's nice to see you here because when we met, I think this was all just an idea, and yeah,
Yeah.
amazing for you for making it happen. So my name is Dr. Rumbi Matenga. I am a doctor GP trainee, like you mentioned, and I'm in my first year of GP training, but this is my fourth year of being a doctor. So F1, foundation year 1, foundation year 2. And then I took a little gap year where I worked a little bit, traveled a little bit, and just lived a little bit. And yeah, now I've started my GP training. Aside from working as a doctor, I help run a nonprofit organization. So I'm the chief strategy officer of a nonprofit called Shake Africa. We're a women's health nonprofit, and we work here in the UK, but also in Africa. So yeah, it's one of my favorite things that I do. On top of that, I am working with a startup that I've co-founded and a few other things here or there, just to, as if working full time is not enough. You just have to add a little bit more.
That's great. So yeah, like you mentioned, we have met before, and I met you at a conference in Nottingham last year. And at that conference, you explained kind of your journey into medical school. So I was wondering if you could explain a little bit more about that for those who are listening.
Absolutely. So I went to school, did my GCSEs, A levels, applied to study medicine, and didn't get an offer. I put four choices of medicine, one choice of midwifery as my backup, and yeah, I did not get any medicine offers. And I came to a crossroads of, do I do the midwifery as a backup? Do I take a gap year? Do I do something like biomedical science or something like that, instead pharmacy? And I thought pursuing midwifery was the fantastic choice for me. One, there was that uncertainty of, wait, if I didn't get into medicine this time, what if I don't get in again? If I
Mm.
do a degree like biomed and then I don't get in, now I'm stuck with a degree I never wanted in the first place. So that
Yeah,
was just not something I was willing to do. And for me, if I never got into medicine but pursued midwifery, I would happily be a midwife to this day? So
yeah.
that was kind of my path. And then I studied midwifery, became a midwife, applied for medicine thereafter, got a place, and here we are today.
And it's such an inspiring story, especially anyone who goes into medicine after doing another degree, because medicine itself is really hard and it's a really long degree anyway. So doing another degree on top of that is really inspiring. What would you say some of the challenges you faced during this time was, like from going from being a midwife into medicine?
I think for me, the first thing was the uncertainty of potentially not getting a place. I mean, we all know medicine is a competitive degree. So is midwifery, mind you, but medicine
Yeah.
is a competitive degree. So there was that little uncertainty of, oh my goodness, what if I don't get in? And once I did get my place, then I had the rude awakening that even if student finance did not pay for your first degree, so my first degree was NHS funded, I didn't get
Yeah.
any tuition fees from student finance. Because you have one degree already, they will not pay for your next degree at the same level. So I thought I would be able to access student finance to study medicine. No, I was not. So that was a little bit of a rude awakening, and it really highlighted then importance of, okay, I had to work to make money to be able to pay for my degree. So that route with midwifery panned out beautifully for me, because if I had done a degree in biomedical science, like what job would I be doing that can help me pay for a whole degree? With
Yeah.
midwifery literally financed my medical degree.
No, that's I didn't know that
Mhm.
about student finance. So that's definitely shocked me. Um, so yeah, you said you worked as a midwife then while you were at medical school. How did you find balancing that and your studies at the same time?
Do you know, when I look back, I think, how did I do that? And sometimes we have to give ourselves the props where they are. I literally graduated with honors. I graduated medicine with honors whilst working a whole other job. How?
Yeah, that's incredible. Yeah, because I'm thinking
People,
now, I couldn't imagine doing that now.
even thinking back at the time, I think you just get on with it.
Mm,
If you're faced with hurdles and challenges, we all have our personalities and how we cope with things. But I think for me, definitely at the time, it was we just need to get on. I need to work because if I don't work, then I actually can't afford to have my degree. So the two go hand in hand.
yeah.
And, just make it work, get it done. I think the nice thing for me was there was an end point, and every year that went by, that end point got closer and closer and closer, and then it just becomes easier and easier and easier.
Yeah, I think especially when you're passionate about something as well and you've worked really hard, it pushes you to do it a bit more, doesn't it? And it gives you that motivation to, okay, I do have to go to work, but this is what the end product's going to be.
Exactly. I completely agree.
And how has this experience, and I suppose also being a midwife, how has it shaped you into the doctor that you are today? Do you think your experience in midwifery has changed your perspective on things compared to other doctors?
I do. I definitely think it has impacted. I mean, firstly, in terms of my training pathway, I didn't have to learn how to do a blood pressure for the first time or how to do bloods for the first time. Like maybe that's why I did well in my degree because then I could focus on the academic things because some of the basic practical skills I already knew how to do, so I didn't have to spend as much time on that. So I think it definitely
Mm.
impacted in that way. Also, the element of interacting with other healthcare professionals, particularly our midwifery colleagues, our nursing colleagues, and every junior doctor will tell you there is a finesse to it. There is a tact, there is a way. And for your life as a doctor, as a junior doctor on the wards to be easy, I mean, it is what it is. The nurses need to like you because if they
Yeah.
don't, your life will be hard. And so I think just having that little understanding just made my job a little bit more enjoyable because the nurses would always go that extra mile for me. And so I would go that extra mile for them and just had a nicer working environment as a result.
Yeah, definitely. It is really important, isn't it? Just to respect everyone that you come into contact with when you're a doctor. Because even if you're having a hard day, the chances are someone else is having a difficult day too. So you can't take that out on your colleagues or anything. And it is important. And it's nice to have those good working relationships too, I think.
I also think part of it was kind of the empathy side because there was a time when I was that midwife who called the doctor to do an ECG because I didn't know, I didn't feel confident
Mm.
in doing an ECG. And so when you have a million jobs on your jobs list and someone calls you to do an ECG, then I didn't have, was someone else might be like, what do you mean? HCAs do ECGs. What do you mean you can't do an ECG? I didn't
Mm.
have that because actually there was a time when that was me.
Yeah.
So I think that empathy side really definitely made an impact as well.
Yeah, definitely. I think just having experience as well, regardless of kind of the type of experience in healthcare, is really important. I know
Agreed.
all of my like lecturers say we can always tell who's been on the wards and who hasn't because it
Hmm.
does change the way you interact with people. So I definitely think, even though you did have a different journey into medicine, it's definitely helped you now with who you are and how you interact with patients, which is great too. And I think it also kind of ties into some of the interests that you have now, if I'm not mistaken, because you do a lot of things with women's health and things, which is nice too.
Definitely, I agree. I think it made me the person that I am right now. Those were my formative years, like 18 to
Mm.
21. I was deep in midwifery. So the interest in women's health really started then, and it's just got bigger and bigger since.
So you mentioned earlier that you're currently an ST1 in GP. So what rotations have you done so far in your
I
training?
I have been so lucky. I have GP was my first job rotation in my GP training, and
That's
my
nice.
second job rotation is GP, and my
Oh.
third job rotation is obs and gynae.
Oh, that's great.
This was it was we ranked jobs. This was my top choice job, like it's
Mm.
just a fantastic way to start the training, jobs that I enjoy, and I'm so thankful for it. I'm having such a fantastic time so far.
No, that's great. Everyone can hope for such good rotations if they're looking to do GP training. So kind of moving on to some of your interests that you do outside of being a doctor, which is already incredible enough, but like you said, you do quite a few other things. So one thing I was interested in hearing a bit more about is when you worked with the UN as a
Mhm.
delegate and how that kind of came about and what was involved with that.
Absolutely. So I've been a delegate to the Commission on the Status of Women with United Nations Women UK, so UN Women UK, 2 years in a row. I want to say CSW, not 3 years, 2 years for sure. And so that all started for me through my work with Shake Africa.
Mm.
So we were working within the women's health space, looking at not just education on our health and our well-being, but also advocating for women in their sexual and reproductive rights. Because unfortunately, the two go hand in hand. You find where women are less empowered about their rights, particularly reproductive rights, then the health outcomes mirror that. So the two go hand
Yeah.
in hand. And that's how I first got involved with UN Women. In terms of attending the Commission on the Status of Women, it's one of those really informative couple of weeks. It goes over 2 weeks, and there's all types of workshops and sessions, as well as the official UN meetings that are going on. Within that, you really get a greater picture of all the things that are impacting women and those assigned female at birth from not just here. I mean, for me, I speak personally from UK experience. And then you say, okay, Shake Africa works within Africa, so we get a little bit of experience there. But what's going on in
Yeah.
Australia? What's going on in Japan? What's going on in Togo? In other places. Togo's in Africa.
Mm.
I do know my geography, but in other places of the world. And that just brings a much bigger insight. So, yeah, that's been really, really insightful for me and just helped me develop and grow a lot further.
No, that sounds amazing, really. And I think it is really important to have those experiences from other places, not just, other countries, other universities, other hospitals, because everywhere can have such a varied experience with their healthcare systems. And especially, I think, hearing about other places' healthcare systems is really important too, because it allows you kind of to reflect on what we experience in the UK. And I know that we definitely have our own problems in the UK with our healthcare systems and things. But then when you hear what's happening in other countries, sometimes you
Hmm.
can say, well, at least we have that happening, even if there's another problem that we're working on solving too. So
It
I'm sure
it
that was a
definitely
really, really good experience.
it brings context as well, and it brings context to what other places are doing really well that we can take
Hmm.
from versus what we're doing well that we can share with others.
Yeah, and just talking to people from other countries as well, because oftentimes you might not have the opportunity to do that. So to bring people together from lots of different places is always good. So you spoke a bit about Shake Africa there, and you're the Chief Strategy Officer for Shake Africa. So can you explain to us what Shake Africa is, when you became involved in it, and kind of the work that you do with Shake Africa?
Absolutely. So Shake Africa is a women's health nonprofit organization. We work towards educating women and those assigned female at birth about their health as well as their reproductive rights. As I said earlier, the two kind of tie hand in hand. We have we look at the sustainable development goals that the UN has set out. And some of the things that you start to pick out in there, things like period poverty and how that ties in, menstruation and well-being, particularly in times of conflict, natural disasters, all of those things. But yeah, at the moment we are education focused, so we're educating women across the lifespan, educating women and those assigned female at birth across the lifespan. That's young women, old women, about healthcare problems that might affect them. And we also do the 16 days of activism, which is a big focus. And that's more towards ending violence against women and girls. And again, that we all these things, intersectionality is a big thing. So all these things tie in together to affect our health outcomes. And ultimately, that's what we are. We are a women's health charity. In terms of how I got involved with Shake Africa, it was in 2019. And I remember it so distinctly. The executive director is a dear friend of mine, and we were in Regent's Park, actually. And she was telling me about this nonprofit that she started and why she started the nonprofit. And she was, she said, okay, this is what I'm doing. Is there any suggestions or any ways that you could chime in and help? So it was more of an informal thing. I would say, oh, why don't you try this? Why don't you try that? And then in 2021, we had our first RTM X-Shake collaboration. So Rumbi the Medic X-Shake Africa collaboration. So we worked on a few things together. And then I became an ambassador for the organization. And then, following different discussions, I feel quite involved with it and how I was helping to drive change within the organization. Naturally, the role of Chief Strategy Officer opened up and I took it.
No, that's wonderful. I think it's nice as well that you were involved for such a long time as well, kind of leading up to it. It's not like you just came into the organisation in that role. You kind of saw it grow and develop from near the start, which is really nice to hear. And I think the work that you're doing is really important, and women's health and those who are assigned female birth health is really important, because I think sometimes it's still a bit of a taboo to even talk about these things, or it's embarrassing, and it shouldn't be. And we should all just be more free to talk about our health and our bodies without being judged or feeling embarrassed about it.
I totally agree with you.
And moving on to that, so you are also involved with Glacy Health. Is that how you pronounce it?
That is how you say it. Well done, yes.
So can you tell me a little bit more about that and kind of your plans for the future with that too?
Absolutely. So I don't think many people have ever heard the word Glacy said out loud. They've seen it written down. So this is great that it reads how it's supposed to sound for me as a co-founder. That's good to know. So thank you. Glacy is a startup that myself and a dear friend of mine have started. And she's an actuary, so she has like a decade experience in insurance. Obviously, I'm a medical doctor, so we're working with a product that covers both those aspects in women's health. So yeah, it's very, very exciting. And 2024 is a big year for Glacy. The first Glacy launch is happening this year.
Oh, I'm very excited to see what it involves, and I'll definitely keep up to date. And where's the best place we can keep up to date with what Glacy is doing?
I would say at the moment, Glacy is Instagram. There's nothing on our Instagram. We are going to start posting stories, I would say, bit by bit. And we're purposefully not saying exactly what the product is for various reasons. It might seem like I'm dodging the question, but for various reasons that is intentional. But we'll start giving little drips and drips and drips on Instagram over the coming weeks, and then things will get more clear over the coming months. So I think at Glacy Health is the handle.
Okay, well, I'll link all of it in the description below for anyone who's interested. And that follows on to my next question quite nicely. So what are your goals for 2024? What do you see yourself doing this year? What do you hope that you can do?
I have reflected so much about that over the last week or so, really just thinking about what outcomes I want from the year, both personally, within my career, financially, all these things. So I guess keeping it career-wise to start, I want to continue going smoothly in my GP training. I don't want any drama. I want that to pan out nice and easily. So I think career-wise, that's number one for me, because the being a doctor is my full-time job. So sometimes you can get sidetracked in all these things and then stop nurturing the actual thing that's paying your bills. So I do want to focus on that quite a bit and make sure I'm
Mm.
progressing the way that I should and gaining skills to help my patients really and truly. So I think ultimately that's the most important thing. From a Glacy side of things, our launch is coming this year and developing things from that perspective. Shake is like my baby, honestly. And it's not just my baby because, like I say, it's a whole team there, as well as Wumi, the executive director. It's truly her baby and my godchild. I think that's a better way to put it. Baby and my godchild. But with Shake, I get such fulfillment from the work that we do, and I will continue to pour into that. I want us to do bigger projects, and we are working on diversifying in terms of our Africa projects with something in Zimbabwe, which would be the first project that we do there, and developing in that sense. So that's from a Shake perspective. I think, yeah, career wise, continue to progress in my GP training, Glacy launch, and broaden Shake.
Yeah, that sounds really nice. And it's lovely to hear you be so passionate about the projects that you're involved in too. Because I do think it is important to have those things that you enjoy doing and working on that are outside of your day to day. They might still be medicine adjacent,
Mm-hmm.
but it's just a bit different to the work that you do in your kind of 9 to 5. And it's great that you're so excited and so passionate about your godchild and all of the work that you're doing with it.
No, I think so. And I think in life we do need to find our passions and our purpose. And the two can be adjacent, they can be completely different. But once you've kind of narrowed down what those are, doing things just becomes easier. That's what I found so far.
Definitely. And I've got just a couple more questions to wrap up. So, my first one is, what has been the best moment in your career so far? So, it can either be when you're a midwife, as a doctor, or even in the things you do outside of medicine. Just what has been kind of the most fulfilling thing you've had so far?
The most fulfilling thing I've had so far. That's a really tricky one. I might say, I think I'll take it to Shake. I think I would say our 16 Days of Activism campaign, because, I mean, 1 in 3 women, this is 2021 data, so I don't know if the stats have changed, but
Mm.
1 in 3 women would have experienced or be in proximity to violence against themselves or women in their family, for example, domestic violence, intimate partner violence. And so to be able to raise awareness for that and have impact, which reached the UN, which reached the founder of He for She, was phenomenal. It also because if we let one person know and that was the end, that would have been amazing. So for it to have gained the momentum that it did and the impact that it had, I mean, for me, I think that's significant.
No, that's really, really incredible to have your voice heard, and also you're giving a voice to all the other people who may not come forward or may not want to say anything. But even seeing the work that you're doing, it makes them realise that they're not alone in whatever
Mhm.
struggle that they're going through. And there's people there who are listening, who understand, and who want to help, definitely.
Absolutely.
And my final question is, what advice would you give to aspiring or current medical students?
So for current medical students, the advice I would give is consider building a personal brand. I think medicine as we know it as a profession is evolving. It really is. And although most doctors will work in their career, in their specialty, and that will be their full-time job, they go home, go to work, and that's what they do, there is definitely an increase of doctors who do that and something else. And I think we need that for us because our job takes a lot. It takes a lot of empathy. It has an emotional toll as well as a physical one. So
Mm.
sometimes to be able to do something else adjacent keeps you fulfilled and topped up to be able to really give during our work, whilst you are a doctor. So I would say just consider that aspect of what are your hobbies, what are your interests, keep them up, do not lose them, keep them up because they will help in your overall well-being. And consider starting to build a personal brand if you think that maybe in 5 years, 10 years, you want to be able to diversify in the work that you do. So I think that's something I would suggest. And for aspiring medical students, similar, the landscape of medicine as a profession is changing. The career that we saw the consultants that are retiring now have versus us that are just entering the workforce now have is different. So I think it's important to evaluate why you want to be a doctor, what aspects of the profession call to you, which aspects don't, because I think sometimes having an understanding of that from early on is really, really helpful. And sit down and think, okay, this is why I want to do it. These are the pros of the profession. These are the good things about the profession, and these are the cons. It's a lengthy journey. So the course is 5 years, 4 years minimum, but 5-6 years for others. And on top of that, the training is another however many years thereafter. So I think you really must be solid in your reasons and your interest in the profession before you embark on the journey.
Definitely. I think that's really, really great advice. And I'm sure everyone listening is really inspired hearing everything that you're talking about. And I'm sure they'll want to learn more. So can you tell us where we can find you on social media?
Yes. Instagram is, it is one of my favorite places. Maybe it's becoming less so now, but I do enjoy Instagram. And my Instagram is at Rumbi the Medic. I have LinkedIn, Rumbi Matenga, and TikTok, Dr. Rumbi Matenga. It's all ever so slightly different. Social media is a good place to find me. But if you actually want to ask me a question or want some input on something, maybe LinkedIn messages might be a good place, although I'm not so good on there. If it really requires an answer, then I would say to email me, info@rumbithemedic.com. That's the most likely chance you are to reach me and get a response.
Okay, great. Well, I'll put all the information on how to contact you and for Glacy and Shake Africa in the description. So if you do want to get in touch with Rumbi or see the work that she's doing, you'll be able to there. But Rumbi, thank you so much for coming on the podcast and having a chat with me this evening. I've loved hearing everything that you're doing. I'm inspired. I'm ready to go out and tackle the world just as much as you are. So thank you so much for coming on.
No, thank you so much for having me. Thank you for thinking of me, and I'm glad to see you action. One thing about having an idea and umming and ahhing, but to actually start it and get the ball rolling is a big step. So I'm really, really proud of you for that.
Thank you.
You are welcome.